Class is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to our webinar, Examine Trends Over 4 Full Years of Open Payments Data. I'm very excited to be hosting Tom Sullivan, who is a dear friend and also the Chief Editor-in-Chief of Policy and Medicine, the most widely read blog and publication within healthcare compliance. Very exciting since we've had 4 full years of data published, and recently, I'm sure some of you may have heard, CMS has hired an analytics company to go through this data, presumably to find things that they're going to come back out to the public with. So very, very excited. Tom is going to share what he found in the data, both from a policy perspective and just in general, combined with his usual sense of humor. So we've had a couple of minutes of delay in start. We had some challenges, technical challenges in getting Tom's presentation and him online. So I'll take a break here, maybe a couple of minutes, try to make sure that Tom is all set up, and then we'll get going in a minute or so here. So I appreciate you holding up for a minute. And we'll try to resolve this technology issue here in a second. Tom, let us know when you're back online and you can reshare your screen.
It says it's showing screen. Is it not showing screen?
It is showing your screen. If you want to, can you try moving to the next slide? Let's see if it's refreshed. I only see your slide 1. So perhaps maybe we can, if you want to stop sharing your screen and reshare, perhaps that will help.
Okay, hold on 1 second. Pause sharing screen and show screen. Okay. How about now? Do you see my screen?
It didn't do anything. It didn't stop sharing for me. So I'm assuming nothing has happened. If you want, you can save the slides and send it over, and I can present it while you speak as well. That works better.
Yeah, I can do that. It's not showing at all?
I still see your first screen. That's all I see right now. It hasn't refreshed to go to a second slide.
Sorry, everybody. Sorry, everybody. We're having technical difficulties. It always happens after you start a program. So anyway, I think I can kind of walk these. How about now? Can you see my slide?
No, not at all. Let me ask Ravish to maybe, Ravish, can you remove Tom from presenter and then remake him the presenter? Maybe that will help, at least from a presentation perspective.
Oh, wow, it's really big.
Okay, and I may have a version of your slides, Tom, that I can probably.
Okay. I just sent it to you again. So can we show, if I can say show screen now, would it work? I'm sorry, everybody.
Okay. Yeah, you can make you the presenter again. Ravish, can you make Tom presenter? And then I'll wait for your slides, Tom. In case this doesn't work, then I'll present the slides. I haven't received your slides yet, though. Looks like Tom just disconnected. Sorry, team, we're having a little bit difficulty getting things started on Tom's end, so we're trying to get that.
When everything comes together, but there's a lot of good data here, guys. It's going to be pretty exciting.
Tom, it looks like you're disconnected from GoToMeeting. Are you dialing back in?
Oh, no. Okay, I can dial back in.
Yeah.
Let me just shut off GoToMeeting then, okay?
Sure.
I'm going to leave the webinar and come back, okay?
Okay, sounds good. Team, give us a couple minutes. Apologize for the technical difficulties here at the start of this webinar. Hopefully we can get Tom's access figured out. There is a lot of good information that he has. The session was first conducted at CBI, August Transparency Conference this year, and Tom has usually done that for the last few years. The reviews of the sessions have been incredible. Tom mixes his humor with some information from the data sets that I think is exciting and eye-opening. So hopefully once we get started, it'll be worth your time, and we'll try to still wrap up within the hour that we have allocated. So once again, thank you for your patience, and appreciate you holding up as we get into this. Tom, let me know when you've joined back in.
Yes, I'm giving 1 second here.
Okay. Tom, I do have an earlier version of your slides. If you need to.
Yeah, you're okay. I think you can, I'll just go to GoToMeeting. I was having a problem with my internet connection, which always is fine, right? So, until you need it.
Okay.
But opener. Okay, I should be in.
All right, if you've logged in, we'll try one more time. Otherwise, we'll present from my laptop. So Ravish,
okay.
Make Tom the presenter.
There, do you see it?
Yeah, I see you. Can we make you? We'll make you the presenter, Tom, and see if you can present.
Yep.
Okay, you're the presenter.
Okay.
All right, we see your screen. Let's go.
Okay.
All right,
so,
welcome everyone. So Tom, I guess we did a quick introduction. Tom is the editor of Policy Innovation. He's also founder and CEO of Rockpoint, an institution that provides CME education. I'm just going to be a fly on the wall in this webinar, just listening as you guys do. My quick introduction: Mohammed Owais, CEO of Core Data. So I'll let Tom run with his show since we're a little late into the webinar. Go ahead, Tom.
Okay, well, thank you very much. Apologize for the technical difficulties on all our ends. I love it when a plan comes together, but it finally came. So we're just going to go through the open payments data real quickly, take you through some trends that have happened, and take it from there. So basically, if you look at Google Trends, there's not much has happened with open payments, with the exception of in 2014, last night, tonight, on HBO covered open payments, and it got a glitch, but I got a hit, but after that it was not very much happening. And now we're going to look at the data. So if you look at open payments data over time, it is really not much change as far as between 2014 and 2017, with the exception that research has gone up by 10% from 4.23 billion to 4.66 billion, and ownership interest has gone down 16.22%. And I'm not sure exactly why it went down. I guess more companies have been sold, or there's less ownership interest from doctors, but that's just what has happened. In addition, and those are for private companies. In addition, if we look at research, it has increased 18.5% over the 4 years. And if we look at teaching hospitals and payments, general payments to teaching hospitals, they've gone down 31% over the last 31.2%. I mean, they've gone up 31.2% over the last 4 years. In entities, we haven't seen much change, but we have seen that there are fewer companies reporting than there were. About 80 fewer companies reporting now than they were in 2014. So if your company, I'm not sure if it's just a delay or what the real is, what that means. In general payments, we see that general payments, the leader in general payments over time, as far as looking at companies, is Genentech, and then followed by Zimmer Bioholdings, DuPuis Synthes, have all had huge amounts of general payments. Edwards Lifesciences had a big jump in general payments last year, but that was a result of buying a company in Maryland. And actually, it's interesting how you can see how some of this data can affect companies over time, and whole states' data can be reported as an increase or decrease based on a company purchase or from one to another. So general payments, if we looked over 4 years, we can see that if you look over time, it's interesting how the payments are tracking absolutely perfect over time as to when they're made. Doesn't matter what year. So you can see that a lot of payments are made in May. A lot of payments are made in August, and then also toward the end of the year in November. If we look at general payments over time series, though, we see that the amounts go down month over month. They basically have all kind of track the same year over year. So it's kind of interesting the way, no matter what the payment is, it tracks over time year over year. When we looked at the bulk of the payments, like when it bulks up, you can see that the number of payments goes up in the beginning of the first quarter. It goes down in the second, in the kind of end of the second quarter. It goes back up again in the third quarter, and the number of payments goes down in the fourth quarter, but the amount of payments go up in the fourth quarter. So it's really interesting to see how all this data, no matter how many people we put in it, it tracks very similar over time. When we look at the top payment, general payments, and we showed you that a little earlier, if we pull out royalties to City of Hope, which was a royalty that Genentech makes to City of Hope for some of their oncology drugs, we can see that basically 94% of Genentech's general payments are in the form of that royalty payment. So, and then we also have, and again, this is another slide that outlines that royalty payments to City of Hope. We have companies with positive annual growth rates. As you can see, Genentech had a 52% increase. Edwards Lifesciences, again, because of the purchase, had a 476% increase. But these are companies that have increased over time. A lot of this has to do with paying royalties and paying or buying companies, where, for instance, a founder may be a physician, and he sells his company to another company, and that company would then report that payment to that physician. We also see increases in general payments. We see that basically general payment increased contribution payments for 136 companies. These are companies that have increased their payments year over year, that they make up about 29 points. In 2014, they made up about 17% of the payments that were made, and in 2017, they made up 30% of the payments. So kind of a shift toward these above 136 companies that are giving more, they're paying more, mostly again in royalty payments out over time. When we look at increasing contributions to general payments above the 136 companies, and we took out City of Hope, we can see that actually if you pull that payment out, it goes from 8% payments to that those companies made to 15.39%. So just one company, one payment by one company can make a huge difference in the data. And actually, we looked at the general payments cash flow from the above 136 companies. These are the companies that increased year over year for those 4 years. We see that Genentech's royalty license was the bulk of the cash flow or the increases in the payment. When we looked at physician specialties, so a lot of times we say, okay, what physician specialties are we seeing changes in? We can see that orthopedic surgery is by far the most, again, royalty payments, and then followed by neurology, endocrinology, neuroscience. And Endonics ended up with 139% increase last year. Again, it was a sale of a company from one to another, but you can kind of see that that a lot of these specialties may rank high in some categories and lower in others. And we'll go through the categories in about a minute. And when we looked at the general payments, top specialties in 2016, as far as the differences, we saw that cardiovascular disease has dropped between 2016 and 2017, 20%. Family medicine has dropped 24%. Ophthalmology has dropped 34.5%. And urology had increased 17.7%. When we look again, this is another way of looking at the data. This is a chart that took out which is the size, and you see again orthopedic surgery again because the royalty payments is way on top. Cardiovascular disease, neurological surgery. It's interesting. Internal medicine and family medicine are kind of smaller, and orthopedics is smaller, just straight orthopedics. We look at the gross change. We can see that immunopathology has grown by 212%. Of course, it's not much money, but it's grown a lot. Body imaging has grown a lot over the time. Behavior neurology and neuropsychiatry has grown. But then we saw decreases in things like internal medicine. It's dropped by one internist has dropped by 84%. Anyway, so you see some drops. It's not big money, but you see some drops. And pediatric critical care has gone from 28 million, which was a sale of a company in 2014, to almost no payments in 2017. In the nature of payment category, we saw that royalty and licenses were the leaders. This is between 2016 and 2017. Consulting fees, food and beverage, compensation for services, other consulting, travel and lodging, and grants. If we looked at the changes in between nature of payments between 2016 and 2017, we see that grants went up by 19.8%, but that education, went down 19.8%, but education went up by 11.8%. So, in similar actually numbers as far as size. So some people are moving money from grants to education. When we looked at the specific royalty, specific payments by specialty, we see that royalties or licenses, orthopedic surgeons and neurological surgeons receive the most in licenses. We saw that consulting fees, and it's interesting, year over year, it didn't matter what the category was, that the change, the leaders always consisted the leaders no matter what happened. So orthopedic surgery was the top for consulting fees year over year. We saw that, and this is one case in which one specialty dropped again for sale of a company, but then endocrinology and diabetes metabolism for compensation for services other than consulting, which is usually promotional speaking. So we saw that drop. We saw that basically that category has stayed in endocrinology. The doctors that eat the most are also the ones that have the most doctors, which are family medicine and internal medicine. And then followed pretty low down the list was cardiovascular disease. But there are about 200,000 between internal medicine and family medicine. There's about 220,000 of them. So that's a lot of meals. But you can see over time that meals has actually been dropping as far as the category goes. When we looked at travel and lodging, it went from usually it kind of goes back and forth between year over year between cardiovascular disease and orthopedic surgery, and in internal medicine being the third that specialty that receives funding for travel and lodging. When we looked at honoraria, neurology was on top 1 year, pretty high, 15 million, but then it just dropped year over year. And we did an analysis. We went through the data and pulled a lot out of these 4 years of data. When we looked at nature of payment by specialty, when we looked at grants, and I'm going to try to go full screen and see if this works. So you tell me if it's still working. Again, internal medicine was the leader in grants and their gifts. It was dentists and general practice. And gifts are not a very large category, between 4 million and now it's somewhere around 3 million to 2 million, depending on the specialty. And then entertainment, we saw that orthodontics, general practice, endodontics, basically dental practices with one general practice, which we believe was probably a miscategorized payment for this past year. In surgery, in education by specialty, surgery clearly gets the most education, which has gone from about 8 million to 11 million over time. So you can see that surgeons are where that money's being spent on education. And then current or prospective ownership interest has that's the one category that's kind of moved all around from hematology, oncology in 2014 to general practice in 2017, but the numbers have greatly reduced over time as far as ownership interest or investment interest. Charitable contributions, ophthalmology, I assume there must be some very good there must be some very good clinics for ophthalmology to help patients in eye clinics, and so this has kind of led them to be the leader year over year. In charitable contributions, we also looked at the companies that contribute, and it's interesting that even companies stay the same year over year. So we looked at companies, charitable contributions. 1 year Celgene was on top, but for the most part, it's Valeant Pharmaceuticals North America that gives the most in charitable contributions, and most of that was out of their Bausch and Lomb division. So again, for eye, for eye treatment. Compensation for services other than consulting. Topera led 1 year in 2014, but then really dropped significantly, and Janssen Pharmaceuticals has been the leader of the compensation for services other than consulting division. Stryker has been a leader in consulting fees. So year over year, they're always pretty much on top on consulting fees. On education, Intuitive Surgical has kind of led the way on payments for education. And then food and beverage, it was AstraZeneca in 2014, and then they've kind of gone down year over year. And then you see Janssen Pharmaceuticals kind of stayed steady, and Allergan has been the leader the last 2 years in the food and beverage category. In gifts, this has kind of been all over the map, but they're basically these are basically surgical companies and dental companies. Or Stryker, Afgen Healthcare Corporation have been kind of leading the way in gifts. But again, that category is a small category compared to others. Often, when we went and broke down the gifts, and we're going to show that in a minute, it really breaks down the loans of equipment and other things that you wouldn't normally consider a gift, but when people run over on their loans. In grants, Celgene Corporation has led the last 2 years, and Boston Scientific gave grants from 2014 to 2017. Teva, in honorarium, Teva Pharmaceuticals led 1 year, and then it's moved between Gilead, Alexion, and Horizon. But as you can see, that category has gone down year over year as far as payments go. Current or prospective ownership interest. This has been also moving between companies. And there's no real pattern to this. It's only to say that it has been, if you look at it overall, it's been going down year over year, with the exception of Topera, which categorized a purchase into 2016. Royalties or licenses, again, because the City of Hope Genentech has led the way, followed by Zimmer Holdings, Inc. And then nature of payments, travel by companies. It's interesting is Medtronic Vascular has spent the most on travel and lodging, mostly for their skills labs that they do, and then also Intuitive Surgical has also done a lot of travel and lodging. As you can see, nature and payment over time, royalties has been really the only category that's been increasing on a consistent basis. Everyone else has kind of remained the same. A little bit of increase in consulting fees, but overall, not much movement in the nature of payment category. When we looked at the differences between these categories, the nature of payment categories, we found that increases were entertainment. Last year, one company, I think, categorized, and I think it's a miscategorization on some entertainment items. Royalties or license went up 23% over 4 years. Charitable contributions went up as well, and space rental or facility teaching fees went up. What went down were current or prospective ownership interest by 57%, honorarium by 37%, and education by 13.98%. So when looked at payments recipients by states, we can see that California received the most in the general payment category. Most of that, again, by the City of Hope, Texas, and New York. And then again, California, but California has basically remained the same between 2016 and 2017, again, because I think the City of Hope payments, even though the payments overall have been going down. In New York, we saw a 17% decrease. Pennsylvania had a 19% decrease. Tennessee had a 19.8% decrease in general payments. And Maryland had a 63.61% increase over those years. But almost all of that was a $30 million purchase last year by one company of another company who was owned by a physician that was located in the state of Maryland. And again, this is the company. Baltimore-based Harpoon Medical was acquired for $100 million, and it was so it shows you that even even one company purchase can affect state-level data. Again, if we looked at the payments by state, California still leads the way, but it's significantly less than it would be if it didn't have the City of Hope payment, which made up for 50% of the payments that were made into the state of California. When we look at the cash flow, California companies to California companies are by far the most New Jersey and Massachusetts. So that kind of stays. If we looked at the recipients by states in the general payment category, we look at the difference. We see that New Mexico has gone up between 2014 and 2017 by 500%. Montana has gone down by 64%, and then other states have moved back and forth. But it just gives you an idea that there, again, purchases of companies, things that are changed, can really make a big difference in how this data is reported, and it can even affect state-level data. Payments by form, we can see that between 2016 and 2017, that cash or cash equivalents was the most, but in kind still is 15% year over year of the types of services. So 15% of the payments that are counted in open payments are actually in-kind payments. If we looked at general payments by company of travel, we can see the United States was by far the most, and then it kind of moved down into Europe and other countries. When we looked at general payments by state, again, most of the payments, the travel is California, Illinois, Florida, and Texas. When we look at the gift category, this is what I was talking about before. We can see the Stryker basically and these are taking from people that put in their data comment field, so it's not 100% accurate, but it's pretty close. We saw that Stryker, most of their gifts were really loans of equipment or write-offs of people that didn't return equipment. Banco Dentical has a customer loyalty program that they do. Carl Zeiss has a product trials that they list things under. Fuji has equipment, grants, and then loans of equipment and end up in the gifts category. MedArts has loans of equipment. So you kind of look through this list and you can see that most of them, that a lot of these payments are really for write-offs and loans of equipment, but they just have no other place to go except for the gift category. It's something that I think open payments should change in the next few years. And then general payment associations, when we looked at general payments, we saw that if you did travel and consulting, you were more likely to eat. You basically you were gonna have you can almost guarantee that a physician would have a meal by 95% confidence indicators, and travel and service other than consulting, you would also have a meal. If not common but interesting rules in general payments, services other than consulting and grants probably meant that you were going to have to do grants, and then education and grants also meant that someone would be doing consulting. So kind of interesting kind of rules, but we thought with looking through the data that was kind of pulling it out. When we looked at the research category, which is the largest payment category by all means, we can see that Pfizer, Novartis, Merck Sharp and Dohme, Amgen, and Bristol Myers Squibb, Eli Lilly, Janssen, Genentech all have pretty robust payments for research payments. We saw a drop by Tesaro for research payments. They're still pretty significant, but they had a drop last year, percentage drop. Some of that was, again, selling off units. And then Roche Molecular Systems also had a pretty significant drop in research payments between last year and the year before. Again, when you're doing your budgeting, this is a very useful slide, because if you know that most research payments are made in May, August, and November, so just understand over time, that's when you'll get your research payments. The states that receive research payments, the most was California, followed by Texas and New York, and then Florida. Actually, Florida, Texas. Florida was third. Interesting. You don't think of necessarily Texas as a huge research hub, but I think it's a growing area for research, and it seems to be a popular spot for pharmaceutical companies to do biomedical research there. Research payments by states, recipients, some of the movement we've seen, Maryland has gone up by 26.5%. Illinois has gone up by 15.81%. And we saw Michigan had a drop of 28%, a drop in research payments between 2016 and 2017. So as far as when we looked over time between 2014, the full 4 years of data, Maryland had the biggest increase, which is 133%. DC had a 113% increase in research payments. North Dakota had a 107% increase in research payments. It wasn't much, but they had a big percent increase. In Iowa is also seeing a big increase in research funding, something that the policymakers should probably use to show that we're spending more money in Iowa. As far as recipients of research payments sorted by differences, as far as those have gotten lower, we've seen in Nebraska, Maine, West Virginia, and Wyoming have all seen decreases in the amount of research funding spent by pharmaceutical and device companies. Research payments by form of payment, we see that in-kind is about 23% of the form of payment. So often that's the product, the cost of delivering the product, and then cash or cash equivalents was 76%, and it's 73%. So it's pretty much steady year over year, but about a quarter of the payments are in kind and a quarter are cash. When we looked at top research payments and we took all 4 years data and we combined them, we see that Novartis actually spent the most on research, followed by Pfizer, Amgen, Merck Sharp and Dohme, AstraZeneca. When we pulled positive annual growth rates in research payments, it was interesting to see that places like Roche Molecular System had a 254% increase in their payments. AstraZeneca UK had a 7,940% increase. So there's a lot of increases year over year between payment, how much they're paying out and how much in research. And some of this might be just some of the research has moved to different divisions within a company. Some of it is actually the companies are spending more on research. When we look at the increasing contribution to research payment for those 53 companies that had year-over-year increases, we saw they went from 17% of the total spend to 32.10% of the total spend. So there's clearly an increase in the contributions has helped out. We did kind of similarities between names of research, not much, kind of the same names over and over again. Safety and tolerability, diabetes kind of comes up year over year. And then, but really, mostly it's safety, studying and evaluating efficacy and safety were kind of the words that came up. So in data summary, there's very differentiation between the 4 years, but our categories tend to be dominated by the same companies, which I think is pretty interesting that the companies kind of categorize, once they take over a category, they stay on top. Outliers will skew the data, as we saw with Edwards Genentech City of Hope or Edward Life Sciences purchase from the state of Maryland. It's still obvious mistakes are made in the data between 2014, 2015, and 2016. Companies still need to review their data even from past years, hopefully to identify outliers before submission to make sure amounts and categories are correct. You need to think about clearing cessational patterns of, there's clear cessational patterns of payments. So everybody's kind of acting in a pack. And then there's small number of companies that drive changes in payments, and general payments of 136 companies out of 1,200. And then research is 53 out of 1,200 drive the increase in that data. So any questions you have on data before we go to the next section, Mohammed?
Tom, so far I don't see any questions from the audience. If there is questions, please feel free to ask Tom. Otherwise, we'll continue and answer in the end.
Okay, very good. I just wanted to make sure if somebody had something they absolutely want to know about the data, we could go through it. I'd also like to cover a little bit about the media coverage from 2018, which I always make part of this presentation year over year. like who's watching us. I thought it was interesting. One of the early stories on last year was male doctors make a lot more in industry payments than female doctors. This was from a JAMA article, but you can see from 2015 that ProPublica also ran the same article. So I figure every 3 years or so we'll hear something about that you're paying men more than you are women. So try to see what you can do to increase your payments to women. We've also seen that another area of kind of looking at this year is editors of top medical journals receiving industry payments. I think that it's interesting to just kind of keep in the back of your mind when you're paying someone. Are they a journal editor? What's their, what kind of other influences do they have? Just so that so it doesn't look like you're trying to influence. And I understand if someone comes to your program and you have you need consulting in a specific area and someone's an expert and they also happen to do the journal, that go ahead and hire them, but just know that they need to also disclose that and be very clear about disclosing that. Another report came out this year about physicians underreporting conflicts of interest from device makers. What has happening now is people are going through studies, they're going through different areas, and they're looking at open payments data and saying, oh, whoa, wait, that guy didn't report this thing or that thing, either on a speech or a study. So it's important that, again, disclosure is a very important thing just to try to keep as accurately as possible. We saw one company that didn't report payments to doctors, largely because they don't believe that they're required to because of the nature of the products that they make. So they're not, it's a tissue stand graft company. So it's kind of back and forth on, is that really a device company? And I think the big story this fall has been the downfall of Jose Bagaglia, who was the chief medical officer for Memorial Sloan Kettering Cancer Center. Dr. Bagaglia failed to disclose some of the payments and some of that were easily found in the open payments database that were also in his journal article submissions. Some of that was administrative. He says it was administrative, that he gives his stuff to people and they're supposed to handle it. But no matter how important you are, you still need to make sure that what's in the open database matches whatever you're saying. And I understand there is a lot of authors will say, well, this paper doesn't really apply to this, or that paper doesn't apply to that. What am I, what am I supposed to do? And so there's a lot of kind of personal, personal judgment calls that are made on these, and the companies are, and the journals are not going to get into the looking in the open payments database. I know we at our company, when we ask for grants, we ask them to look in the open payments database when we hire a physician for his conflicts of interest, we ask them to, please look at it, make sure that you look through your open payments database, make sure that everything's in there, that so you don't get in trouble. He also said he failed to disclose any industry relationships in more than 100 of about 60% of the time of his journal articles. And these were what they pulled up from not just this, but also from company disclosures, not just from open payments, but they also looked at company disclosures. I believe that there was probably some internal people at Memorial Sloan Kettering that had it out for this guy, but just know that he was on all these boards, and he just needs to, and any faculty that you hire, any faculty that you work with, or any doctors that you work with as far as on your board of directors, just encourage them to make sure that they disclose that in their journal articles and their education programs. We also saw that they're looking now how Medicare, the relationship between Medicare claims, the press now is looking between Medicare claims and what manufacturers are paying physicians. We can see that Medicare spent $2 billion on one drug, as manufacturers paid millions of doctors. And so it happens to be a drug that was pretty cheap, and it's a generic drug that was pretty cheap. It became a because of lack of supply, became something a little bit more than that. And we can see that basically between 2011 and 2016, the claim count went up pretty high, but then the total spending also went up. So just imagine that the press is going to be using this year over year. These are easy stories to write. Doesn't take a lot of work to put these together. These were the top paid physicians and the number of co-payments, the number of payments, and the and how much they spent, how much they were reimbursed by Medicare. So it just it doesn't take a lot to just kind of go through things. And then CNN says, how did they report on that card? They actually wrote a story on how they reported on the story, which is kind of unusual for press, but in some way they thought it was pretty cool. They went through the open payments data to calculate how much Apgar's manufacturers paid doctors between 2013 and 2017. They looked on the general payments, which excluded payments for research, and then they went through their analysis. But the bottom line is, people are looking at your data. You need to make sure that your data is accurate. This was another big Netflix play, which is called Bleeding Edge. Netflix program, Bleeding Edge. A lot of stories came out of that. In one of the, I know that there's a real concern about physicians disclosing, especially to patients, for off-label uses that they're doing off-label for device companies. Just encourage, if a physician's going to use something off-label, that he discloses that to his patient. And then also, if he has a relationship with you, it's probably, if he's doing something off-label, he also needs to probably disclose that to the patient if he's going to do an off-label procedure. CNN also said Bayer paid millions of dollars for questionable birth control devices. Of course, one of the titles was "It Looks Like a Broad." Again, these are not the kind of stories that you want as corporate counsel or to be written. So it's important that you kind of stay ahead of who you're paying, what you're paying them for, what kind of relationship you have with that physician, and that he's disclosing those things. Actually, CNN did a big series, and I'm not going to run it, but is your doctor being paid by a drug company? I encourage you to kind of Google that and watch that segment, because it does talk about how to look up in the open payments database. The HHS-OIG did look at the open payments program. It said it needed to improve its data. But I thought what was interesting was when you looked at the number of missing values, it was very, very, very small and not a lot of data. So basically less than 0.1% of fields were missing data. And some of the missing data, like the name of a research study, was really one out of several million. So it's not like this data is very, very, very good. This is right from the HHS-OIG reports where we created this chart. I know that science is worried about hidden conflict, pharma payments to FDA advisors after drug approvals. I'm not sure what anybody does about something like that. How you prevent somebody from getting a job after they go. There's no rules right now for even government employees. There's a rule, I think it's only a 1 year, 18-month rule before they can work if you're a political appointee. But if you're a regular person, you can just go right into the private sector, and nobody, it doesn't matter. 2018, I think this last year, is the opioid crisis, as we've seen that, and linking it back to open payments. And we can see that stories are made, where you have a villain, you have there's kids involved, there's people, and you can see, trying to fight back the villain. And often the pharmaceutical device companies are the villains in these stories. The more opioids doctors prescribe, the more money they make is another story. This was a woman that said, I trusted my doctor, he gave me fentanyl. Of course, it has to be incest, which is probably a case study in how not to be a pharmaceutical company. And a lot of their people actually will end up in federal prison, I believe, over time. Again, this is just a personal statement. But you can just see how they just kind of wrote the story as to showing the increases, how doctors who are more likely to get opioid manufacturers are more likely to pay doctors for opioid prescriptions. And then this is one doctor, this is Big Moon, and then this is the doctors on average. So they kind of show that her doctor was especially bad. Often these are brought to the media by key tam lawyers or other types of plaintiff attorneys who bring the whole case to them and say, listen, this is a bad thing. And, you know, and most reporters will say, yeah, this is a bad thing. We got to stop it. And then, twice as many opioid prescriptions per patient annually compared to his colleagues. And then this is the methodology and how they did it. Again, they used the open payments data and the prescription data but an interesting, the healthcare blog did an analysis of the same data and the relationship between payments and you can see that basically an opioid prescription is written, and you can see that basically this is not there's a correlation. There's not really a correlation if you look at it on a scatter plot. It's kind of basically the number of payments received, the total number of payments received, and then when they look at it even deeper, and they said, well, where do you see changes in average RX counts? 0 to 1 is 113 prescriptions per month. These are for pain prescriptions, and you can see over time. Then it's not until you get to over $65,000 do you see any real change in the number of prescriptions, and a lot of that is just because your companies are really targeting the doctors who are kind of the high thought leaders in that area, and they also tend to have the most patients, and they tend to do the most prescribing. As we can see, though, from the fentanyl, that we are going to see doctors. Excuse me, my computer has decided to continue working. It wants to reboot. And so we can see that several Manhattan doctors this year were indicted for bribes for taking money from. This was in the case of incest. So it's not just the companies that are at risk, but also the doctors that you work at. If they're doing something that may not, if they're doing, as incest's case, doing things that the government thought was inappropriate. And my computer, okay. We also look at association of marketing with opioid products. And again, this is more looking at incest, but they saw a lot. And again, number of meals received in 2014, and they looked over time, and they saw, whoa, wow, if you get a lot of meals, if you get over 10, you write more. But again, we looked at the scatter plot, and yes, there is a semi-correlation over time, but it's not really that many more opioid prescriptions versus number of meals accepted. Minnesota is looking at opioid pain, and I believe that, you know, keep an eye out. This is the first time they've looked at their gift ban, so think over time you're going to see a change in that. New York also has written a report on this. So again, on the opioid findings, again, prescribing patterns in their state and payments to physicians. I think these are reports that you as an officer at your company should know about. Opioid payments have actually cut back on marketing and payments to doctors, so that even when you cut back and you say, we really need to reduce this, they're going to still write stories about you no matter what you do. And so that's kind of the end of the media coverage. As far as legislation, there was one bill introduced by Claire McCaskill, which was the Patient Advocacy Transparency Act, that basically wanted to report payments for everybody. That didn't end up going anywhere, but several senators sponsored a transparency bill to fighting opioid epidemic with Sunshine Act, which added nurse practitioners and physician assistants to the list of covered recipients, and also open payments eliminates the MPI number restriction starting in 2022. All this starts in 2022. It starts in the reporting year 2022, not in the 2021. So if you're thinking about when do I need to include nurse practitioner and physician assistant data, it's going to be in your 2022 data, which will be in the 2023 report. And the president signed that bill, and so now it's part of law. So just get ready for it as a company. Also, we saw that, again, Mohammed referred to this earlier, the government oversight is coming to open payments. Econometrica, which is an organization in Bethesda, Maryland, has been awarded $13 million to study open payments data. And so just think about this. If we can do this on a shoestring, I can't even imagine what these guys will be able to pull out of this data. So it's really important that you know what works inside your data. And then, oh, I went backwards. Okay. They've also
on that note around Econometrica and the increased scrutiny on open payments, any recommendation from your side as folks look towards reporting for the 2018 season, which is just coming up in around the corner?
Well, I think you actually should go back and look through all your data just to make sure what you've submitted was accurate, right? I know you've signed it, and to just make sure that to look and see if you have any outlier payments that maybe were miscategorized. I know, for instance, when we looked in the meals category, we found a lot of big payments in meals, but in the end of the day, it was either the payment was to an institution, and so they counted the payment was to the whole group, or it was miscategorized and needs to be recategorized. There's also quite a few companies that just go back and make sure that you've submitted that your data is accurate. That's all I can say. That's all I really want to go into right now. But just make sure that you have accurate data. And then in your 2019 report, which is your 2018 data, again, just go look through outliers, make sure there's nothing there. There's nothing there that someone would look at from the outside and say, why is that? And if there is something there, make sure you document why it's there and what it was for, so that you're not caught off guard when someone calls you and tells you at 3 o'clock in the afternoon that they have a 5 o'clock deadline. And can you comment on this? So just understand, that sometimes people ask questions pretty close to the deadline, so that you may or may not be able to figure out exactly what that was. So again, if you document everything, you have it all there, you're good. If you're missing payments or like 1 year you reported in one category, the next year you didn't report anything in that category, you may want to go back and look and just see why that happened.
Great, thank you, Tom.
Okay. Again, there's a new mapping tool from Open Payments Data. I encourage you to kind of look at it. It kind of tells you where the doctors are that live near you, that are in the Open Payments database. And the bigger the number around their name, the more money they got, which is kind of silly, but that's okay. In summary of media coverage, pharma is a very big target, and it's a bipartisan target. We've seen with the president even this last week. Failure to disclose can be a mortal sin, so you really encourage your doctors. I mean, Dr. Bazalga basically was fired from Memorial Sloan Kettering, lost his board seats on several of those public companies. So it's really not worth it. Increase in link in prescriber data. You'll see increasing in the link of prescription data to attorneys and researchers that'll, especially once they get the NCI numbers, it'll be a lot easier. You'll see it hide to a health crisis. Today it's opioids, tomorrow it'll be something else, but there's always a health crisis. As states and Medicaid, I think you're going to see more and more states interested in this data, because it's going to cost them more and more money as their bills come in for the expansion. That will recycle stories. So even though you said, well, that story was written a long time ago, well, they'll just, every 3 or 4 years, people move jobs, they don't remember, so they write another story. The studies are relatively easy to do, so a lot of graduate students do these kind of studies. And data is not always that simple. It's not always a straight story. There's a lot behind data, but data is data. And then look for more in-depth coverage, I think, in the future. One of the things I think is interesting is I don't know if we'll ever see another Patrick Sussing. Patrick is worth $7.6 billion. He happens to own the Lakers, one of my favorite sports teams. But overall, he was a Chinese immigrant born in South Africa, and he started Abraxis and American Pharmaceutical Partners for a combined $9.1 billion. Those kind of payments would really skew the database right now. You can imagine, a $6 million sale by one doctor, and it would just freak everybody. It would just totally freak out the system. So understand it's kind of, this is a guy who's really done a lot of good. He owns the LA Times, but I'm not sure he'll ever be able to, but the patients benefit from his kind of research. So I just hope it doesn't discourage doctors from being able to do this. I also encourage you to stay up to date. We have a couple publications, Policy in Medicine, and now we just changed Life Science Compliance Update to Policy in Medicine Compliance Update. I encourage you, that's a subscription service, but it's a lot of really, really, really good articles in there. Very, very, very in-depth. So I also like to thank Raymond, who helped me put this data together. He's a data management candidate at the University of Maryland, College Park. Again, if I can go through this data, other people can. Here's my information. Is there any questions or anything like that we have?
Yes, Tom, there's a couple of questions that I'm going to repeat if you can quickly answer. I know we're running over time. So the first question is, while Dr. Baselga's failure to disclose payments is extreme, did your research show any indication that physicians don't understand the level of detail in the reporting and only disclose payments and do not consider other transfers of value such as expenses and travel reimbursement?
Well, that's a really good point, and they don't think about that, right? They don't necessarily know what, if 25% of the payments are for are for in-kind payments, for instance, they don't know what the value of that is. So somehow the physicians need to either look at open payments data, but let's say you did something in 2018, you published a paper in 2018, you got an in-kind contribution, you didn't disclose that. You just have to somehow stay on top of that. It's a lot more difficult than it sounds.
Yeah, makes sense, Tom. And I guess physicians need some way to be able to log in what the spend against them is, which I think is hard for many of the physicians. There was a couple of additional comments that I don't know if we can answer now, but one of the participants said the correlations that you showed were really cool. They would love to see more of that. And then one participant said, I think it was related to something in the entertainment expenses. When you say obvious mistakes, do you mean more than just the possible jump in the dollar amount for entertainment? But I guess that's related to some slide that we are already past. And in the interest of time, I just feel that we want to close this out on the hour. I know we started a few minutes late. If there is additional questions or comments or thoughts for Tom or for CoreData in terms of scheduling and organizing webinars like this, feel free to send it out. We'll be sending you a recording of this webinar as well, so you can pass it around to your colleagues at work as well. I would just want to take this opportunity to thank Tom for making the time, and thank you all for making the time to attend. Hopefully it was it added value to your time. Thank you, Tom, and thank you, everyone.
Well, thank you. And everybody, I just apologize for the issues at the beginning, but unfortunately those things happen. So if anybody's interested in a set of slides, you can ask me myself or Mohammed for a set, and we'll send it over to you.
Great. Thank you, Tom. Thank you, everyone. Take care.
All right.
Bye-bye.